Our 9 Health expert, Dr. Payal Kohli, is with us now to answer some of the frequently asked questions that we've gotten about COVID-19 and the vaccine. So we start with this one. Many people asking if they've in fact had COVID, do they still need to get a vaccination?
An increasing proportion of our population is now falling into this, right? And before it was all theoretical. We said, oh, the science probably suggests that you should. Now we have data, we have studies that came out of the CDC done in Kentucky that shows if you've had COVID and you get the vaccine, your protection, you're twice as protected as somebody who's had COVID and doesn't get the vaccine.
So yes.
Absolutely, yes.
I think a lot of people have said this in part as an excuse if they don't want to get the vaccine. But put that aside, if you have had COVID, then how long do you wait before you get the vaccine? Is there like, okay, I've been recovered for a month, or what does it matter?
So an important question, and a little bit depends on how severe your COVID illness was. But the idea here, you guys, is that when your immune system is activated from the COVID and then you get the vaccine too soon, your immune system can actually sort of reject the vaccine and prevent it from doing its job. So the magic window appears to be about 2 to 3 months. So not too soon, not too late, but you definitely want to get it within the first few months of having the infection.
We were asked if people who've had COVID don't get vaccinated, are they still protected? You kind of just touched on that a minute ago. So I want to ask you, when you talk about the immune system response, is that your immunity against everything, or is it all pretty specific to COVID and its variants?
So, you know, getting COVID is a different immune response than getting the vaccine. So when you get the vaccine, you have only made antibodies to the spike protein, because that's the only part of the virus that you've seen. When you get COVID, you actually make antibodies to every part of the virus, including the actual, you know, the capsid it's called, as well as the spike protein. So you have polyclonal antibodies, many different types. Now that's good in a way, but the bad thing about that is that they're not as good at neutralizing the virus. So if we look in the lab, those antibodies don't work as well to neutralize the virus. So that's why that vaccine really helps to boost those neutralizing antibodies.
Plus you have the variants and everything else that play into this. So how do you tell if you have the antibodies from, like, you've had COVID or because you had the vaccination?
A lot of my patients are asking me this question. They're coming in and saying, I don't know if I had COVID or not. How can I tell? You want to check antibodies against the capsule. So remember what I just said. The only thing you make antibodies to is the spike if you've gotten the vaccine. But if you've gotten the virus, you'll have antibodies against the capsule as well.
In the break, we were just talking about the other vaccine, the flu vaccine. You and I both have gotten our shots recently. You got yours as well?
Don't forget me.
But you didn't say you had. You didn't come forward. So we got the flu vaccine. That's still important. That is unrelated and still valuable and necessary.
Critically important, Tom. And this year they've actually made it quadrivalent, so it's 4 strains, so to speak. And it's more important this year than it was last year because our masks are coming off. And we don't have the protection from last year because most of us, thankfully, didn't get the flu last year. So some experts are predicting it may even be a worse season this year because the masks have come off and we don't have a little bit of that immunity left over from last year.
And since I had to yell at you.
Why didn't you tell us? We were just talking about it.
It takes 2 weeks too, usually, right?
It does.
I'm sorry,
Yeah,
I know we're out of time,
vaccines.
but usually 2 weeks again, plan on. Okay.
Oh, we're not out of time for your vaccination story.
It wasn't that memorable. I'm just
shot?
saying I got my shot and I didn't even notice it.
Right?
Mine was that I hardly even noticed that it
Didn't
happened.
notice at all.
Yeah,
Yeah.
so
And now is the perfect
pretty
window.
easy.
Let's not wait too long because before Halloween you have to have that shot in that arm so that we're protected this year.
she's a doctor. She would know.
She would know.
I went to college for over a year. I mean, and I agree with you.
Okay.
Dr. Kohli, thanks as always. Good to see you.